It's Dr. Birchler. All right, I'm going to make a video and some comments here today on ear infections. And when I say infections, I use the term that a lot of people use, and frankly, one of the points of discussion here is going to be a lot of times that term is used incorrectly. There may be no evidence of an infection, but there may be pain. And this is something that a lot of moms and kids are dealing with, and it can be something that's distressing. There can be fear involved. There can be misnomers like the term infection involved at times. There's tie-ins to food and diet and all kinds of things involved with this. So I'm going to go pretty quick on this on account of time, and the order may or may not be perfectly logical, but I'm just going to start going through a few things here. So the first thing is, a lot of times people will say things like they have an infection or they have a virus or things. In fact, is they have no idea what they have, but it hurts. So it would be more accurate to use the term ear pain if somebody has child has ear pain, as opposed to ear infection. Now the child may have fever associated with this. And one of the main issues that comes into play with this is this fear of fever, and there's probably a lot of reasons for that, but largely communication from the medical world or something, that the mindset that if you have a symptom that something is wrong, when in fact the body is just doing exactly what it needs to do to correct whatever is going on there. And so fever is normal in that case, and you may or may not like it. There may be symptoms with that, but that's the body's own response, immune response, and resolution to that. And when you really get into kind of chiropractic philosophy, and you understand that, like, the power that made the body, that's running the body, like you're sleeping and it's making your heart beat and your lungs breathe and digesting your food, like it is not making mistakes. It's not like it doesn't know what to do. And it's the same with fever. It's not like, oh, it has a fever, that's going to go out of control or something. No, the body will do exactly what it needs to do. So probably the number one thing that if I could encourage or exhort you would be the fear of fever is just the body's doing exactly the right thing. Just let it run its course, and that's going to give you the simplest solution with the least likelihood of doing some kind of treatment and getting side effects and recurrence and all these kind of things. Okay, the times where fever would go out of control is if the brain is actually damaged. Now, what would actually cause that? Really chemical damage from vaccination or things that are that they're designed to cause an inflammatory response in theory, but they can cause an encephalitis and lead the brain to be inflamed, and then it does not. It's like the brain is affected, and so when you get fever that is out of control, it may be in response to something like that. But barring a situation like that where the brain is actually damaged or chemically altered, the body's just going to do exactly what it's supposed to do, exactly the right temperature for exactly the right length of time to resolve the issue, and just sitting through and waiting through that, even though it takes time and we don't like it, that's really the best solution. Okay, so back to the concept of why I say don't necessarily call it infection. There have been studies for decades of time. I remember reading through this stuff 20 years ago that pediatricians and people use the term ear infections, but when you go to the doctor, rarely to never do they actually swab the ear to show, hey, there's bacteria there. They just say there's an ear infection, or they look in it and it looks puffy or distended or whatever. Studies that actually swab them show that the huge majority of the time, probably something like 85% of the time, there may be no bacteria. There does not really appear to be bacterial infection, but there may be distension of the eardrum, so there's mucus, there's irritation, there's redness, there's things like that, but it may not be an infection. So there's some other cause related to swelling, mucus, things like that are causing the pain. So, but if you use the term infection, your brain thinks that somehow infection, I need antibiotics, and then you take antibiotics, and then you get all this negative stuff that happens from that. So, I try to train parents to not even use that word because the huge majority of the time it is not accurate, and then it leads you to a damaging solution because you think that you need some kind of treatment of the infection. Okay. Additionally, there have been studies for probably 45 years or so now. I think 1980 there was some landmark clinical trial with different treatment groups and control groups and things showing that regardless of having tubes or antibiotics versus no treatment at all, the resolution of ear infection or ear pain was similar in all groups, but the groups that had antibiotics had a higher recurrence of ear infection. So again, non-treatment, the best option in my opinion. Okay. After taking antibiotics, you then have to deal with the negative consequence of that, which is then going to be disruption of the body's normal flora, what may be called dysbiosis. And so when you take some kind of antibiotic, it's going to change the bacteria that line the nasal canal. It's gonna line the mouth in the pharynx and everything in there, and the whole digestive tract. You may get different bacteria, pathogenic bacteria, yeast, different things like that then lead to recurrence of symptoms down the road. So, taking that antibiotic or continuing to do that again and again is going to lead to a whole host of problems there. So, what I would encourage people is don't do it the first time, because then you can avoid a lot of that. But even if you've done it the first time, stop that cycle. Don't do it anymore. Let the body go through whatever it has to just let things run its course, and it'll find its own way. I'm going to pause for a second, and then we'll continue. Okay, so another reason to avoid the antibiotic intervention is that, again, for quite a long time at this point, there's been a well-known association that the more antibiotics a child has, especially in the first couple years of life, they have a much higher incidence of asthma, and that kind of asthma, atopic spectrum problems. So in reference to at least one study, and there's been years since I looked at this, but basically that particular study showed something to the effect of if a kid had even four doses of antibiotics, or 4 courses of antibiotics in the first 2 years of life, they had like a 50% increased risk of asthma, which is the number one childhood chronic disease. So something that is going on for years that affects them in childhood. So a lot of people would think they don't understand the connection of asthma to disruption of flora and all these kind of things, and toxicity issues, largely going back to antibiotics. But a lot of kids with asthma and various allergy, atopic type of syndromes, a lot of that can be traced back to antibiotics based on the data. Okay, so as a chiropractor, I see a lot of kids with ear pain, kids with actually pussy goop coming out of their ears. I don't see that a lot. But let's just kind of go back to what's probably going on in some of these cases. All right. When there is a problem in the body, virus, bacteria, whatever is going on there, and the body wants to fix it, the body is going to have some kind of inflammatory response, and we tend to think, inflammation is bad. Well, no, that's the body doing what it needs to do. That's how the body fixes stuff. You sprain your ankle and it swells. That's not bad. That's what the body needs to do to repair the injured ligaments. So inflammation is not bad. That's normal. It's the process that leads to calling cells in to repair, to fix it, and will lead to resolution. But what happens is somebody says, they have pain, and let's give them an anti-inflammatory, blah, and so they stop. These chemicals stop what the body is actually doing to fix it, and so you then have what would have been an acute inflammatory process, commonly 1, 2, 3 to 7 days, maybe let's just say 3 days commonly, and then the pain and fever and all that stuff would commonly resolve, and maybe they wouldn't have much trouble with that ever again, frankly. But then a child is given this medicine, and it stops that inflammation. So now you have an acute inflammation process that did not resolve, and you basically have a chronic inflammation at that point. All right, so there's been incomplete resolution, and so the antibiotics, anti-inflammatories, these kind of fever medicines that lower fever, all of these things may tie into that same kind of like inhibiting a full resolution of the whatever is initially going on there, and all of them are going to lead to higher recurrence rates, right? Now, if somebody then does not have, let's say a kid has that go on, and the body did not get to go through its whole course of the immune system, getting rid of bacteria, resolving the inflammatory process. Now you get recurrent ear infection and possibly antibiotic resistance, different things going on that you may get this kind of pus or actual bacteria infection. And those are situations there that's not really what I'm designed to handle. Maybe those things need tubes and drain and all kind of stuff there. But what I'm getting at here is it would be nice to avoid that whole situation in the first place, and the best thing to do would be, frankly, to like do nothing, just let the body resolve it. And we'll talk here in a moment about some things related to diet or other things that could be helpful in this topic. But sometimes do nothing. As a chiropractor, we want to check the nervous system and make sure there's no interference to the nervous system that ties into these areas. I've seen enough in my practice career to know that there are definitely some kids that seem to have chronic recurrent trouble. They start getting adjusted and they do better. And whether that's all from the adjustment or if it's from the communication of the doctor to the parents or whatever, there might be multiple dynamics there, but I do think there's something to that. That being said, I don't think that's the only factor. I think there's other factors going on that we're talking through here as well, outside of just a neurological effect from the spine with ear infections, right? Okay, so a couple comments on breastfeeding versus bottle feeding. And while the point of this isn't some kind of guilt thing or whatever, I get there's all kind of scenarios, but I do think this is something that's relevant. So clearly, breast milk versus formula milk, one is kind of like from the mother, and the way that nature is so amazing. It just the baby's saliva contacting the mother, the mother's body somehow like knows what to do and produces antibodies in the milk that then go to the baby to help fight off infection. So there's this passive immunity from breast milk that can occur that I do think is probably very significant in response to this. So certainly that's part of the discussion in terms of breastfeeding versus not breastfeeding, probably an effect there. Okay. Then also mechanical effect. So when a baby breastfeeds, they're going to have to latch on, and they're going to have to kind of suck, but they're going to have to to breathe or unlatch or things like that in order to continue to do that. Whereas with a bottle, where the bottle may have this release valve on the bottle to help to help the airflow, so the baby can kind of suck without unlatching necessarily, because there's an air release valve. They have to suck hard to get this out, and they're able to continuously do that because of the little hole in the where they're feeding to relieve that pressure. And so they may mechanically get like a negative pressure thing going on while they're bottle feeding, and that negative pressure may then draw stuff into the eustachian tube just as a pressure gradient, milk, saliva, other kind of things, bacteria from the mouth that normally wouldn't get in there without a negative pressure. So there may be something to do with bottle feeding mechanically that kind of draws things that shouldn't be in the middle ear get into the middle ear because of a pressure differential. So something to consider in terms of bottle feeding there as well, right? Last thing here I'm going to talk about is a lot of times as kids get say they're breastfeeding and then they stop doing that, or maybe they start using a formula. Maybe they're on a cow-based formula, or maybe they start drinking milk as a kid. And without getting real deep on this, like many things in our society, cows have been genetically bred to do have a certain amount of milk production, things like that. And if you've never read about A1 milk versus A2 milk, This has to do with the genetics of the cows. You can get verified A2 milk at the store now. It's actually relatively available. For years it wasn't, because a lot of this stuff is understood. That would be normal, this A2 gene in the cows. But with cow breeding, a lot of cows have this A1 gene, and for when the casein protein in milk is made, when that A1 casein protein is broken down into peptides, they're very, very mucus forming. Lungs, sinuses, ears, all that kind of stuff. So kids that constantly sniffling, snotty, coughy, croupy, all kind of stuff there's this mucus forming effect of A1 milk. So if you are going to have the kids on cow's milk, I would do a little due diligence in understanding A1 versus A2 milk, and I would certainly do A2 milk over A1, just based on all of that. And I'm just going to give you that information. You can look at that on your own, but a lot of people are probably not aware of that. But in my opinion, and even experience, even with our kids years ago, I would say that there's definitely something significant to that. All right. So hopefully this is at least helpful on some of the dynamics there, and you have some takeaways. We want you and your family to be pain-free, healthy, and I know these conversations can take a while to have. My point here is not to be judgmental or anything like that, but to just give you an opinion based on experience, based off taking care of a lot of families and kids, having kids myself, and certainly wanting to advise people wisely when it comes to this kind of scenario, which is very, very common. This almost always comes up with parents and kids at some point. Okay. If this is helpful, let me know what you found helpful. If you have questions, you certainly let me know, and we'll do our best to help you. Okay.